Good afternoon, everyone. Hi. Thank you all for joining us today. Baptist Health and WJCT are pleased to present today's Lunch and Learn with Pamela Rama, MD. Dr. Rama is a non-invasive preventative cardiologist who serves as Chief of Staff for Baptist Medical Center Beaches, as well as the Medical Director of Cardiopulmonary Rehabilitation. Dr. Rama did her training in cardiology and also was an instructor at Brown University in Providence, Rhode Island. She also completed a residency in internal medicine at Yale University. She is a fellow of the American College of Cardiology and the American Society of Nuclear Cardiology, has served as chair of the Sister to Sister Health Fair, and has been involved with Go Red for Women and Speaking of Women's Health. She is also most recently the medical director of HeartWise for Women, which you're going to hear about today, which is a new health program in our community offered by Baptist Health. HeartWise for Women is designed to help women proactively identify their risk of heart disease because 80% of heart disease can be prevented. Please join me in welcoming Dr. Rama.
Thank you, Amanda. Thank you for coming here today. It's so appropriate. It's Valentine's Day. You're here to hear a lecture about the heart. So I'm really happy that you came today. So let's get started. There are certain myths when it comes to heart disease. You know, women still think that breast cancer is their #1 killer of women, that cardiovascular disease is a man's disease. We've always thought of it as a widowmaker rather than a widower maker. And that the risk factors and symptoms of cardiovascular disease for men and women are the same. And that women are treated medically the same as men are when they present with a cardiac event. Well, what's the truth? Well, the facts are cardiovascular disease kills more women by the age of 45. So more women die of cardiovascular disease. More women die of cardiovascular disease than all cancers combined. And since 1984, there's actually been more women dying compared to men. Some of the risk factors are very specific to women and are also more dangerous to women. And women tend to neglect their symptoms and their risk. So cardiovascular disease also, you'll see in my talk, develops very differently in women compared to men. So this is the mortality rate of or trends for men and women. So since 1984, as I mentioned, more women have died. And we've really done an incredible job in reducing the death rate from heart disease overall. I mean, it's gone down over the decade by 28%. And that's because of the medications that we have and the stents and the bypasses and the new procedures that we have. But when you look at the graph of who's dying, it is estimated that this year alone, 100,000 more women will die of cardiovascular disease and heart attacks compared to men. So this is really no longer a men's disease. This is the disease that can affect any gender or any race. So just to give you a little bit of a lesson in anatomy. So your coronary arteries, the arteries that supply blood into your heart, and you have the ones that supply the left side of your heart, and the right coronary artery supplies the lower portion of your heart and the right ventricle. Now, on this slide, you will see a normal artery. The artery is nice and it's red. This is the lumen where blood passes through, and you see it's wide open. But through the years, you can develop some plaque in that artery that causes an impedance in the flow of blood. And so when you have a lot of plaque in there or enough plaque in there, there's a chance that the blood won't flow into the coronary arteries and then affect the heart ultimately. So one of the other myths is that, you know, cardiovascular disease, that just happens in older people. We don't have to worry about that. Well, actually, that is not true. When they did autopsies of children aged 10 to 12 years old, they saw the first sign of cholesterol plaquing in their arteries. So what I say is that cardiovascular disease is really a disease of the youth that presents itself in adulthood. Okay? So if you're going to make changes, or if you want the incidence of heart disease to go down, you need to really treat younger people. Get them to do the positive lifestyle changes to prevent it. So and as I mentioned earlier, there may be some difference in the plaque formation in women. Now, a majority of patients who are having heart attacks or having angina is the chest discomfort that you develop when you have coronary artery disease. will have plaques that are very similar to this one, okay? Where you have the plaque going inwards, and so when you do a cardiac catheterization and inject dye into the arteries, you're going to see a blockage of maybe around 90% in this area of your heart. Well, what we found out with women is that their plaque may not form the same way as men's do. So they're not really just little men, okay? So what happens in women is the plaque may form outward. So when they do a cardiac catheterization, you know, people will say, well, she's having chest pains, but her coronary arteries are completely normal. Well, that's really not the case, because when you look at the arteries, and we've seen this in autopsy studies, you know, the plaque is growing outward. So they have small arteries because the artery is filled with plaquing. The problem is that when they're labeled as having normal coronary arteries, you think that they'll never die of heart disease at least. But what we found out is when we follow these patients, their prognosis are actually not that good. Okay, so they can have a cardiac event 10 years down the line. So what are the differences in risk factors? Now, LDL cholesterol is your lousy cholesterol. That's how you remember that it's bad, because you want to lower it, okay? So it's less predictive of cardiovascular disease in women compared to men. Now, the high triglyceride levels and low HDL. Now, HDL is your healthy cholesterol, and you want that high. So you have to remember that. It's more predictive of cardiovascular disease in women compared to men. Diabetes, a deadlier disease in women. You know, it increases your risk of developing cardiovascular disease 3 to 7-fold as opposed to men, where it increases the risk of developing cardiovascular disease 2 to 4-fold. And a certain enzyme or hormone in your body, it's called the C-reactive protein, is an inflammatory marker that's in your body. It seems to be very predictive of cardiovascular disease, particularly in women as well. So, and then, more recently, we've found out that there are certain gender-specific risk factors. So you would think that the last thing in your minds when you're pregnant is having a heart attack. But apparently, complications that you get while you're pregnant can predict if you're going to have a heart attack in the future. For example, you know, if you have gestational hypertension, if your blood pressure goes up when you're pregnant, or if you have preeclampsia, or if your glucose level goes up when you're pregnant. So if you have gestational diabetes. Now, you think that these patients, by definition, have diabetes only when they're pregnant. Well, what they did was they followed these patients over the years. And they found out that if you had diabetes and if you had high blood pressure when you were pregnant, you have a 50% chance of developing full-blown diabetes and hypertension 20 years later. So you're talking about women developing hypertension and diabetes in their 40s and their 50s at a very young age. And you know very well that diabetes and hypertension are significant risk factors for heart disease. So, and you know, your risk factors have sort of a multiplier effect. So the more risk factors you have, the more likely you are to develop cardiovascular disease. So the chances you have 10 times more likely to develop cardiovascular disease if you have 3 or more of the risk factors. And we're going to go over all that later on. So the American Heart Association, the Go Red for Women, has done an incredible job letting women be aware that heart disease is their #1 health risk. So in the 1980s, probably only 20% of women were afraid of heart disease. By the time 2004 came, it went up to around 68%. So 68% of women actually are aware that their #1 health risk is cardiovascular disease. However, only 13% really think that it can happen to them. So only 13% personalize it. If I told you, does anyone know the lifetime risk for developing breast cancer? Your lifetime risk for developing breast cancer is 1 in 8. Your lifetime risk for developing a heart attack and a stroke is 1 in 2. So if you look in your table, one of the 2 of you is going to have heart disease, okay? Yet people don't personalize it. We always want to say, it's going to be the other person. It's not going to be me. And that's what the problem is. The other important thing, one of the reasons why women get treated late is because they're not aware of the symptoms of heart disease. Now, a majority of patients will have the typical symptoms. They describe it to me as a substernal chest heaviness. They always correct me, Dr. Rama, it's not the pain, it's really a heavy feeling like an elephant or a brick in my chest. It is usually precipitated by exertion, so usually people are shoveling snow, which we don't have to deal with here, but doing something very active, and it's relieved by resting or by taking sublingual nitroglycerin. So nitroglycerin relieves the chest discomfort. Well, the problem with women is that they may experience cardiovascular disease symptoms very differently. First of all, they're more likely to experience pain when they're not doing anything. Okay, the most common complaint I have is I'm just so stressed out, and they start developing chest discomfort because of that. Women often have symptoms in location other than the chest area, so it's not unusual for me to see patients complaining of a toothache or jaw pain or arm pain. Indigestion or stomach pain is also a very common symptom among women. And atypical symptoms are also very common. So atypical symptoms meaning fatigability. I mean, how many of us haven't been tired in your lifetime? Now, the symptoms that they complain about and that you need to be aware about is, for example, you're able to vacuum one room in your house without, your whole house without any problems. And then all of a sudden, you're vacuuming one room and you are so tired and you can't do anything and you need to stop. That can be a symptom. Without having chest discomfort, that can be a symptom of coronary artery disease for you. Breathlessness or being really short of breath, palpitations or nausea or sweating. Sometimes those can be symptoms of a heart attack in women that you fail to recognize. Now, and they've studied this. Why do we know this? Because we've studied it, okay? So they looked at all these patients, men and women, who actually went to the emergency room with a diagnosed heart attack. So when they went to the emergency room, they had blood tests done, and they were diagnosed to have a heart attack. Well, men were more likely to complain of chest discomfort and feeling sweaty and diaphoretic. What did women complain about? Back pain, jaw pain, nausea, neck pain, and shortness of breath. I mean, things that you would never imagine could be a heart attack. What are the differences in heart attack outcomes? Why are we so concerned about coronary artery disease? Well, we are concerned because in 64% of women, their first presenting event is sudden cardiac death. They never have a second chance, okay? As opposed to 50% of men. The mortality rate, so the likelihood that a female will die first year after a heart attack is 38% compared to 25% for men. And if you're a woman less than 50 years old and you present with a heart attack, you're twice more likely to die compared to a male presenting at the same age. So the younger women, and we don't know why that is. Part of it is because there's a delay in recognizing your symptoms, and part of it is there's a delay in diagnosing. But if they come in with a heart attack, they are twice as likely to have a complication or die from the event. Now, are they treated differently? Well, we've established that more women die of heart attack each year than men, but they are diagnosed and treated less aggressively. So if you look at everyone in the United States who'd received angioplasties or stents. Stents are the life-saving devices that opens up the arteries when you're having a heart attack. Only 33% of that went to women, okay? Only 28% of implantable defibrillators. What are defibrillators? They're special kinds of devices, almost looks like a pacemaker, that watches out to see if you have any ventricular arrhythmia or an abnormal heart rhythm. This actually prevents sudden cardiac death. Okay, and it's been shown to prevent sudden death, yet only 28% of women have received implantable defibrillators. Only 36% of all open heart surgeries that's done in the United States is done in women, and only 27% of cardiac transplants are done in women. So there is a discrepancy. Despite more women dying of cardiovascular disease, it seems like the treatment and they're receiving life-saving procedures and devices happens or occurs less often in women. Now, how do you reduce your risk? Well, the number one way of reducing your risk is knowing what your risk factor is. Okay, so at this point, everyone here in this room should have had their cholesterol checked at some point in their life. The recommendation is as soon as you hit 20, you need to know what your cholesterol level is. You need to know what your glucose level is. And you need to really know your numbers, and I will go over the numbers with you. You have to know the symptoms of heart disease and heart attack. And you have to implement heart-healthy habits. I just mentioned to you earlier that 64% of women, their first presenting event is sudden cardiac death. They're never given a chance. So we need to prevent heart disease in women, and we need to prevent heart disease in men as well. But you have to implement heart-healthy habits, and you have to implement it early on to make a difference. So what is your goal? These are your optimal numbers. You want your blood pressure to be at 120/80. So in most patients, we tell them, get it down below 140/90. And this is your optimal number, 120/80. Your LDL cholesterol, which is your lousy cholesterol, we want that low, should be less than 100. Just an aside, do you know what monkeys and toddlers have in common? They never have heart attacks. We've never documented a child with a heart attack. Do you know what their LDL cholesterol is? It's 70, okay? And so this is what our goal is, but the optimal goal, especially if you have diabetes or you've had a heart attack in the past, you want to get that down to less than 70. Your HDL cholesterol, which is your healthy cholesterol, needs to be 45 or greater. Your triglyceride, 150. Your fasting blood sugar, which determines if you are diabetic, needs to be less than 100. Your BMI is how we measure if you're obese or underweight or overweight, and this should be less than 25. And your waist circumference as a female needs to be less than 35 inches or less than 45 inches if you're a male. Now, why do we focus on the fat in the waist? Well, what we've discovered lately is that fat in your waistline is what travels to your heart. So it's metabolically active, and it's the metabolically active cholesterol that goes into your bloodstream. So the fat that you have in your hips may not look good, but at least it stays there, okay? It doesn't go to your heart. Now, eating a heart-healthy plan. I mean, a lot of my patients as a cardiologist ask me, well, tell me, should I do the South Beach diet? So should I do the Atkins diet? And let me tell you, there are so many diets out there. Let me advance this a little bit. Diets, okay? So there are so many diets, and there's a diet for everyone out there. You have the alkaline diet, you have the earth diet. I don't know the details of some of these diets, but let me tell you. So there's the grapefruit diet, where all you do is eat grapefruit, and then you have the cabbage diet, where all you eat is cabbage. Everyone's familiar with the Jenny Craig diet. There's even an Israelite army diet. I bet they're very strict with that, and it's probably kosher. So there's a junk food diet. I'm sure every one of you would like to know what that is. But lots of diets. So really, the best way to lose weight is to have your stomach stapled to your upper lip. We haven't found a way of doing that, but as soon as we do, we will let you know, okay? Now, this brings us to another topic. Now, this looks like a big term. It's called postprandial dysmetabolism. So what does that mean, okay? Well, after a meal, your glucose and triglyceride level increases. Now, we showed you that the glucose is a risk factor and triglycerides are risk factors as well. So postprandial dysmetabolism just means an abnormality in your glucose and triglyceride levels after a meal. Unfortunately, when you eat meals high in refined sugars and saturated fat, it causes an exaggeration or an exaggerated increase in the glucose, insulin, and triglyceride levels. So regardless of what you eat, your glucose will go up and your triglyceride would go up. But if you don't make the healthy choices, your glucose will exponentially go up, your triglycerides will go really way up, and along with it comes insulin. Now, what we've found out is that the extra glucose and free fatty acid can really cause a lot of havoc in your system because it releases free radicals. Now, what are free radicals? Free radicals are very unstable cells. And what they do is they need to move around quickly and bump into more stable cells so that it will stop moving. Now, when they do that, they can destroy cell membranes, they can destroy DNAs, they can destroy RNAs. And what it does really is it increases your inflammation in your arteries especially, It causes your LDL cholesterol, which is your lousy cholesterol, to be more oxidized. When it becomes more oxidized, it becomes stickier. So it tends to stick to your arteries more. It causes your arteries to constrict, and it causes some clotting. So imagine that going on 3 times a day, every time you eat a meal that is not healthy for you. So what have we found out? That if you have this exaggerated response to eating, that it increases your risk for developing cardiovascular death and all-cause mortality. It also increases your risk for developing diabetes in the future. If you increase your intake of saturated fat, it will cause an immediate increase in your triglyceride level, and this in turn has been associated with cardiac events. So, so we have data documenting that. I know that this might be a slide that's kind of complicated, but really it's very easy. So when you look at this upper slide, as you eat, this is what I'm telling you, the triglyceride level goes up and your glucose level goes up as well. And so what the smart scientists did was they looked at all of these types of inflammatory markers and enzymes that's released in your body, and they found out that the C-reactive protein actually goes up as well. So as your glucose and your triglyceride level goes up, all these markers from inflammation goes up as well. So the inflammation starts occurring in your body. And this is a marker of the ability of your blood vessels to dilate, and that goes down. So can you imagine that happening 3 times a day, every time you eat a meal? And we've seen that, and it's been associated. So when your sugars tend to be high after eating, it is associated with progression of plaques. And if your sugars are down, you have less of the progression. So you actually have a regression of the plaque in your coronary arteries. So we've been through the diets. So what do we recommend as cardiologists? So what diet do I actually recommend my patients? Well, we have come about, what we noticed was the people who lived in Greece and in Italy, they do what we call the Mediterranean diet, and they tend to be very heart healthy. I mean, there's less heart attack and strokes in Greece. And so this is basically the diet that we do recommend, is the Mediterranean diet. So comparing it to the USDA diet over here, and this is the Mediterranean diet, you would see that there's some amount of pasta and breads and fibers in it, but they do use whole grain breads and fibers. You have a lot more fruits and vegetables. Olive oil, mainstay, okay, of a Mediterranean diet. It's very good for you. Cheese and yogurt. You have fish and poultry, which are white meat and fish, very good for you. Very little sweets and eggs, and very little red meat. Okay, so this is the difference in the Mediterranean diet. And I'd like to break it down for you to give you an idea of what we really want you to do as far as the Mediterranean diet is concerned. First of all, why do we recommend the Mediterranean diet? Because it's the only diet that actually has outcome data, okay? So this is a study, it's called the Lyon Heart Study. And basically, they looked at patients, 605 patients who have had heart attacks. So these are the sickest patients. And they put them, and they were treated with appropriate medications. They had cholesterol medications, they were on aspirin, they were all on beta blockers, which are great medications to prevent recurrent cardiac events in patients who've had heart attacks. But aside from that, they randomized them to receive either the Mediterranean diet or the Western diet. And they followed these patients 5 years down the line. And what did they find? They found a 70% reduction in a recurrent cardiac event. So 70% reduction in death and heart attacks in the patients who stuck to the Mediterranean diet. Now, 70% is an incredible number. It is better than any medications I can give you, okay? When you look at your cholesterol medications, what does it do? It prevents your likelihood of having a recurrent event by 35%. Well, this diet is double that, okay? So what do they have? First, there's an abundant use of olive oil for cooking and dressing. So olive oil, a mainstay. There's an increased consumption of fruits and vegetables, beans or legumes, and fish. There's a reduction in the total meat consumption. So you eat either white meat instead of red meat or processed meat. What else do they do? They prepare a lot of their homemade sauces with tomatoes and garlic, onion, spices, and olive oil to dress vegetables, pasta, and rice. They really, part of the we don't have butter or cream or fast foods and sweets and sugared sweetened beverages when you talk about the Mediterranean diet. And I'm sure some of you will be happy about this. Among alcohol drinkers, if you did, it is really part of the Mediterranean diet as long as you do it moderately. Red wine, okay? And we'll go over that again. Okay, so it got me to thinking, well, you know what? People ask me, what do I have to do? I mean, easy steps. I think you need baby steps sometimes. And sometimes it's hard to just go into a diet. So I have my top 10 list of things to do, okay? The number one is fish oil and fish. You need to eat fish, okay? So why? Because it reduces your triglyceride levels, as I told you. We mentioned that earlier. Ventricular arrhythmias are abnormal heart rhythms. This is the number one killer because it causes sudden cardiac death. We've seen a reduction in this in patients who either ate fish or took fish oil capsules. It decreases your fibrinogen levels and platelets. These are blood factors that causes clumping or stickiness of your blood. It reduces your blood pressure. It improves your arteries' ability to dilate and improves your mood. So people who eat a lot of fish and fish oil tend to be happier. And it reduces your cardiovascular events as well. And the main sources are all obviously marine sources, which is fish oil capsule or oily fish. And I would stick to salmon, tuna, sardines, herring, trout, or cod. For pregnant women, we tell them to avoid shark, tilefish, swordfish, and mackerel, obviously because of the mercury content. Unfortunately, when you fry the fish, you eliminate all the beneficial effects. And I know some smarty one will tell me, what if we fried the fish in olive oil? I'm sure one of you will ask that. Well, actually, I researched that because somebody did ask me about that. And apparently, frying it in olive oil is much better. So you retain some of the beneficial effect, but it needs to be olive oil. See, I told you, someone's clapping there. But baked or grilled is very good. We do have a prescription strength for the fish oil, which is called Lavesa. The reason why there are so many fatty acids. So when you get all of these fish capsules, that's over the counter, it contains a different amount of the free fatty acids. And the fatty acids are the ones that's important. The two important ones or therapeutic ones are your EPA and your DHA. The prescription strength has 90% of that. Okay, the over-the-counter one contains around 60% of that. So you want to, and of course the prescription strength ones are more expensive. So if you want to go with the over-the-counter one, that's fine. You might have to take more pills than the prescription strength one. Look for cold water sources because it has less contamination. So less of the Southeast Asian sources and more of the cold water sources. Okay? People complain of nausea, bloating, belching. People smell like fish. Cats following you all over the place. But what we've discovered is that if you put it in the freezer and take it from the freezer, it eliminates the GI side effects. So if you want to do that, just leave it in your freezer. Okay? So what are the guidelines? And we've studied this in 100,000 patients who had heart attacks, and we know that it's good. So if you don't have coronary artery disease, then stick to 2 to 3 helpings of fish a week. If you do have coronary artery disease, get 1 capsule of the fish oil should be enough for you. Now, if you have coronary artery disease or you've had a heart attack, we would recommend 1,000 milligrams a day, or 1 to 2 capsules a day. If you have coronary artery disease and you have a history of increased triglycerides, we may recommend more. And sometimes we tell you to do 2 to 4 capsules of the fish oil a day. Okay? So the number 9, vinegar, add it. Very good for you as well. It was used as a home remedy for diabetes long before we had medications for diabetes. What it does is it slows down gastric emptying, delays carbohydrate absorption. It improves satiety, so it actually makes you feel full sooner. It lowers your postprandial glucose. So there's the term again, postprandial. So the glucose level after a meal is reduced by around 25 to 35%. And it increases your feeling full by 2-fold. Now, I've heard diets wherein you take a tablespoon of vinegar right before you eat. It makes you feel full fast, but it has a lot of acid, so you need to be careful with that. What I would recommend is add it with the olive oil and the vinegar in your salad. Number 8, chocolate. Enjoy it and love it. Okay, wait, before you bring that out, the reason why is it contains flavonoids, and flavonoids are very powerful antioxidants. Remember I mentioned the free radicals earlier on? Well, what we found out is the free radicals, to get rid of those, you need antioxidants. And so chocolates are very good antioxidants. It can reduce your blood pressure and your risk for cardiovascular events. And you know, the chocolates with the highest cocoa content showed the best results. And by cocoa, you want really the dark chocolate. And you really need to be aware of the sugar, because the sweeter it is, like the milk chocolate, it has a lot of calories because it has a lot of sugar. So if you want it to be effective for you for cardiovascular risk reduction, you will want to choose the dark chocolate, okay? And they studied this among the Germans who know their chocolate, and they, you know, asked them, how much chocolate do you eat? And they looked at them and looked to see how many of them develop cardiovascular events in the future, and there was a clear reduction in that. So chocolate's good for you. Next one, green tea, drink it. I didn't know this, but it apparently is the second most consumed beverage in the world, second only to water. I would think it was coffee, but it's green tea. It contains polyphenols proven to be preventive agents for cardiovascular disease, but we really don't know yet what the mechanism of action is. Very hard to really do a study about green tea. It may be secondary to free radical scavenging or antioxidant effect. Now, they've looked at other teas. They haven't really looked at it as well as green tea. Where do they find the most people or population that drinks green tea? Of course, it's in Japan. They looked at 40,000 patients who drank tea. They asked them about their tea drinking habits. More than 5 cups a day, the all-cause mortality was reduced by 12% in men and 23% in women. And I think the difference is seen, the benefit is seen more in non-smokers. And I think the reason why you see this difference is that there were more men who smoked in Japan than women. But seems to have no effect on the cancer mortality. The jury is still out with that. But if you enjoy your tea, go ahead. You might have significant benefit drinking green tea. Next one is vitamin D. Take it. This is the best indicator of your overall vitamin status, your 25-hydroxy vitamin D. It's a quick blood test, just like any other blood test that you do. The thing that makes you at risk for vitamin D deficiency is obviously the people who live in the northern latitudes. But let me tell you, God intended for us to walk around naked 24 hours a day. If you're not doing that, you're vitamin deficient. You're vitamin D deficient. And so I have seen a lot of my patients, since I've started checking vitamin D levels, actually be deficient. So don't think because you're in Florida that you're safe from vitamin D deficiency. If you fail to get at least 15 minutes of direct sun exposure, and you're talking about 10 in the morning until 2 in the afternoon, you're probably vitamin D deficient. African Americans, because the melatonin prevents you from absorbing the UVB lights, they're vitamin D deficient. Elderly, let me tell you, they say that by the age of 50, the layer of skin that absorbs the UV rays atrophies. So you don't have the ability, you're not really able to absorb the pre-vitamin, the UVB lights to transform it into a pre-vitamin. So, and overweight or obese patients, because when you, for some reason, when all the vitamin D is stored in your belly, it's really not that effective. You have to have it in your bloodstream. It is really now considered more of a hormone rather than a vitamin, and it has very significant anti-inflammatory effects. It can reduce your blood pressure. It helps the body absorb calcium and improves bone health. It regulates your immune system, and it may lower your risk for type 2 diabetes. So there is so much buzz about vitamin D now that the NIH is sponsoring a trial of vitamin D and fish oil. They plan on enrolling around 20,000 men and women, and they're going to assess the risk of risk of cancer, heart disease, stroke, and autoimmune diseases like rheumatoid arthritis and SLE and lupus. Okay, so there's a big buzz about it. Let me tell you, prostate cancer tends to be very aggressive about, especially in African American males. When they're diagnosed, it's far advanced, and they're diagnosed at a young age. And the one thing that they have in common is that they are vitamin D deficient. So for your men, if you tell them, encourage them to have their vitamin D levels checked. Cinnamon, sprinkle it. Who knew, right? Cinnamon? It may mimic the effects of insulin and cellular glucose uptake, and it improves your postprandial glucose. So your glucose level after eating is improved if you add cinnamon to your dish. Its studies support the use in diabetes as an adjunct medication. So some of you who are diabetics, your doctors may tell you to go ahead and eat some cinnamon. The dose is typically from 1 to 6 grams daily. I think one of the pills has probably 1 gram, so you need to take around 4 to 6 of those pills. But if you just want to sprinkle it, 1 teaspoon is equal to 4.7 grams. So if you put 1.5 teaspoons in your oatmeal in the morning, you're good to go, okay? So sprinkle it in your oatmeal, it's very good. Number 4, alcohol. Drink it, but we have a disclaimer here, in moderation. And if you don't drink, don't start now, okay? Now, we have studied alcohol for many years, and really, when you look at the mortality curve, this is just the death rate. The people who benefit the most from alcohol are the ones who drink it in moderation. So around 1 glass for women, 2 glasses for men. Once you increase the intake of alcohol, the mortality rate increases. The reason why I have to mention it, that moderation is really the key. We want you to drink 1 glass of wine. Now, you know, there are lots of different glasses now. They've been, you know, glasses this big. Okay, the glasses we're talking about is just 5 ounces, okay? The good thing is we have seen it with liquor as well. So if you want liquor or even beer, so we've seen it in beer as well. It reduces plaque deposits in arteries. It protects against blood clots and increases your HDL cholesterol. HDL cholesterol is your healthy cholesterol, and it contains antioxidants or flavonoids. Now, heavy drinking, though, increases your risk for stroke, cancer, liver disease, and congestive heart failure. And especially recently, there's some data that even moderate drinking can increase your risk for breast cancer. So I implore you, if you have breast cancer, if you have a strong risk factor for breast cancer, like you have family history for that, it's best for you not to start drinking. The rest of you, go ahead and enjoy your alcohol. Yes, per day. Now, this is coffee. Savor it. Now, we've been back and forth with coffee for many years now. It's been very controversial. We finally have a study in 2008 that looked at nurses and healthcare professionals, so men and women. 86,000 of the nurses followed them for 24 years. And what we know is there is no increase in mortality and consumption of 1 to 6 cups of coffee a day. And there was actually a trend towards reducing all-cause mortality. Now, you might be all too shaky after drinking 5 cups of coffee, but there was a trend towards less development of type 2 diabetes as well, and you have antioxidant effects. It does not cause, we always think, oh, I can't drink coffee because it's going to cause chronic hypertension. Well, it really doesn't. And it is safe in pregnant patients. Now, what I know about coffee is that the metabolism, the reason why there's been so much controversy with coffee is because the metabolism of coffee is different for different patients. So if you are the patient that gets palpitations or headaches with coffee, don't start drinking it now, okay? There are other things you can do, like olive oil or chocolates even. Now, number 2 is olive oil. Use it. It contains monosaturated fatty acids, so not all fats is bad for you. The unsaturated fatty acids, particularly the ones, especially the ones that you see in avocado and oil are very good for you. They're less oxidized. It reduces your insulin resistance. It's an antioxidant compound. It reduces the inflammation in your body, and it reduces your risk of diabetes by 52%, So use olive oil, 3 tablespoons of olive oil a day, good for you. And the number 1 health thing that is really very easy to do is nuts. You love nuts? Good. Snack on them, okay? And we have seen beneficial effect in all kinds of nuts. As a matter of fact, they did a study. They gave a group of people white bread and potatoes, checked their blood sugar level. Next day, gave them again white bread and potatoes. This time around, gave them a handful of nuts along with it. And it could be almonds, pistachios, or peanuts. And they found out that the glucose level, that's rise in the glucose level, decreased by 50%. Okay? So nuts have monounsaturated fatty acid as well. The most commonly studied one are the walnuts, 3 grams a day with Mediterranean diet. It can reduce your blood pressure, your fasting blood glucose, and your inflammation, even compared with a low-fat diet. So if you did a Mediterranean diet with walnuts, it can reduce all these bad players, blood pressure, fasting blood sugar, and inflammation. So what we recommend is 5 times a week, get a handful of nuts. It can reduce your coronary artery disease and diabetes risk by 20 to 50%, so it's very good. So 80% of cardiac events in women can be prevented if we make the right lifestyle choices. In other words, if you start lifestyle changes, not being obese, exercising, eating heart healthy, and not smoking, you can reduce your lifetime risk by 80%. Okay, so very good numbers. So, but really, we really must start focusing on the more unique aspects of women's hearts to save more lives. Now, I just want to briefly talk to you about the HeartWise program for Baptists. You know, if you know somebody, especially now if you want to give them Valentine's gift, we do screening for patients who don't have primary care physicians, or even if you have, we do screenings, and what we do is we do a risk assessment, a personalized risk assessment. We look at your family history, we look at your medical history, and we go over and screen for your lipids, your blood sugar, and your C-reactive protein. We do EKGs, and we do counseling, an hour counseling for follow-up care and coordination. It's a very good program. And I think the most important thing, especially for our younger counterparts, when they're in their 20s and 30s, just to help them realize that cardiovascular disease is really their #1 health risk. And hopefully that will make them change their lifestyle to prevent them from developing cardiovascular disease in the future. Okay, thank you very much. Thank you. Do you have any questions? Yes.
I was wondering, I love your slides and your lecture
Sure.
material. Do you have it available to actually view and read?
Well, we could, yeah, if you talk to Amanda, we will give you a copy that we give our patients that's easy to read and review. So we'll give. WJCT.org will have it. Yes, ma'am.
Can you talk a little bit about flaxseed
Okay. Now,
or sunflower seed?
there's a question about flaxseed. You know, flaxseed, the important thing about you can hear me, right? Yeah. So you could just ask them the questions, right? The important thing about the flaxseed is what you're really trying to accomplish is getting the free fatty acids, which is omega-3. Okay, so what flax seeds and walnut does, it gives you a non-seafood source of your omega-3 fatty acids. So if you don't like seafood, you can go with flaxseed, you can go with walnuts, because it will give you the omega-3 fatty acid.
Sunflower seeds?
Sunflower seeds as well. Sunflower seeds more of the monounsaturated, monounsaturated fats. Yes. Yes, ma'am.
So 2 questions.
Sure.
If we can't get a fish oil prescription and we want to just buy them over the counter, do we only look for that cold water source?
Well, the cold water sources is only because there's some data. Well, later on, maybe we can go with the other sources of that. The reason why we recommend the cold water sources is because it has less contamination. What's really important with your fish oil is the amount of EPA and DHA that it has. So if that is over 500 milligrams, you're good to go with the fish oil.
And the olive oil, do you recommend just regular cold, you know?
What does she say? ABEBVV? Yeah, the extra virgin, there it is. Extra virgin olive oil. Yes, yes. Yeah, and the good data about it too is the frying. That's a new thing, you know. We usually say don't fry foods because it causes carcinogens. But what we found out now is that olive oil is so stable that you could actually fry food for it and still be healthy for you. Okay, but if you have a choice, you would rather bake and grill. Yes, ma'am.
Hi. Just asking, I'm 48 years old, and last month I asked my doctor for an echo, and he refused me. Let me tell you what led up to this. My mother and her sister both died from large hearts. Okay. My sister, just January 9th, went into Walmart to shop. They thought she was having an asthma attack, as she usually does. She was transported to St. Vincent. She asked them to pass Shands, that she was just having an asthma attack. At St. Vincent, she flatlined.
Oh,
they brought her back.
They did, okay.
She flatlined again. She
she
died from a massive heart attack. I want an echo. how do I become professionally aggressive with my doctor to get him on the roll with my concern of heart disease?
Right. Well, first of all, there are other tests that you could do to determine if you're at risk for heart disease. The echo is not the only thing.
Okay, what
but I
exactly
think
is
that
an
an echo is an ultrasound of the heart. It doesn't show you coronary arteries. You have to remember that. But if you had a problem with the heart, like a weak heart or valve problems, you will be able to see that. If you are long-standing hypertensive, so if you've had blood pressure issues for a long time, you could see changes in the heart as well that will show up on an echocardiogram. The one thing that I tell my patients is that if you have a strong family history, if you're having chest discomfort, you need to say it out there. You say, I think I have something wrong with me and I think it's my heart. And if you preface it with that, at least they think about it. You know, I'll tell you about a patient of mine who for 5 weeks was complaining of indigestion. She saw the doctor sent her to a gastroenterologist, had an endoscopy, it all looked perfect, kept having chest discomfort until the day of her heart attack. So it was so bad, she went to the emergency room, they figured out she was having a heart attack, they opened up the artery with a stent, and she had never had the same pain again. So it was, you know, and you see this time and again, especially with younger patients. And it was so bad that her gastroenterologist actually went to her room and apologized to her for not thinking of the heart. So I think that if you go in there and say, you know, because a lot of women too, and I'll tell you, I have patients, this is from personal experience. They tell me, I have chest pain, but it's nothing. When you say that, your doctor will say, well, okay, it's nothing, you know. Most of them will at least. So you go in there and tell them, my concern is I may be having a heart issue. And they will listen to you, and everything from then on is geared towards ruling out the worst thing it can be, which is heart issue. See, the problem is that, you know, anything in this area in your chest can cause you to have chest pains. You know, the lung scan, the bone scan, but what kills you is heart disease and not the bone problem and not the stomach problem. So my feeling is that when somebody comes to me with chest discomfort, I want to rule out the worst thing it can be. Okay, and once that's ruled out, then we can look for other reasons. And let me tell you, anxiety is really the last of my list. If I think that my patient feels bad enough that they need to see me, it's not anxiety. Okay?
One more.
Yes, yes, yes.
What about coconut oil? Tell me.
Coconut oil, it does not really have the good type of oil that we have. I would stay away from coconut oil. I know that there are some people who's pushing coconut oil for now, but they're really polyunsaturated fatty acids, not good for you. Later on, maybe we can recommend it, but not now. Oh, okay, we'll do.
What's the cost for the 1-hour HeartWise screening? Is there a charge for that? If it is, how much is it?
It's a $69 charge for the HeartWise for women. Yes.
The other question is, I noticed in your speech, you didn't talk anything about walking or exercising.
Right. We focused on diets here, but walking is really very good for you. And what we recommend as far as walking and exercising is concerned is 150 minutes, which amounts to maybe around 30 minutes a day of exercise. And you know, you have to remember that if you can't find 30 minutes, and as women, we have so many responsibilities, we really don't have time for ourselves. If you divide it up to 10-minute increments, it works just as well. Okay, so if you can't find the 10 minutes in your time to exercise, or the 30 minutes to an hour of exercise, do it in 10-minute increments. Yes, ma'am.
My question is about vitamin D.
Yes.
You say we need to take extra vitamin D, or taking these Central Silver vitamins containing the vitamin D is
Right.
sufficient?
Okay, the first thing is you remember about vitamin D is the supplement that really improves the levels is vitamin D3. So it's vitamin D3. And you know, the supplements like Centrum Silver only have 400 units of that. You really need around 1,000, 2,000. Some people need around 10,000 of that. So most of the regular vitamins or multivitamins, it's very insufficient. It's not that great, yeah. Yes, ma'am.
My name is Dr. Melba Wright. I am a physician, and you are the most dynamic, beautiful, wonderful lecturer I have ever met, and you have inspired me so much.
Okay. Thank you. Thank you.
Thank you. Thank you.
It's easy when you talk about something you're really passionate about. Yes, ma'am.
I'm prescribed 2,000, whatever.
I use it.
I use it.
Yes.
But I also take a multivitamin.
Right.
So the little 25% on that wasn't, that isn't too much for me to take.
No. As a matter of fact, what we know now that is really very difficult to get vitamin D toxicity. Before we were afraid of vitamin D because it's not one of those vitamin Ds that you just pee out. You know, it stays in your bloodstream and it stays in your cells. However, what we know now is that it's very hard to get toxic with it. I mean, you're talking about people who take 10,000 units a day. So you're okay. You're okay. Yes, ma'am. Okay, you're talking about CoQ10. We have some data with CoQ10. The most common use for it in our practice is if you're on a cholesterol medication, you tend to have a lot of the muscle aches because the medication itself depletes CoQ10. So to relieve that, we give patients vitamin D and coenzyme Q10. So that's the use of the CoQ10 for the muscle. Any more questions? Yes, ma'am.
Vitamin D. I take vitamin D and omega and the fish oil.
Yes.
But I take them for the skin.
Oh, the absorbed one. Yes.
For I have psoriasis, and that seems to give me a little more oil in my skin.
Right.
Instead of outward. I work the inside, but I didn't know I was doing two things at one time. Thank you.
Yes, you're welcome. Any other questions? Okay. Well, happy Valentine's Day to everyone. Thank you.